Nick Cook, the Director of Public Policy for the Michigan Coalition Against Homelessness. This is the August Legislative Action Committee meeting. We have a lot to get through. A lot of things have been going on since the last time everybody was here in June. I came on board July, so thankfully the Michigan Coalition Against Homelessness didn't throw me right into the frying pan on day one. So I appreciate everybody giving me some grace and postponing the July meeting till August. Without much further ado, I want to get right into the guest speaker for the month of August. Today we have Marie Gress with us. Since 2023, she has served as the executive director for the Western Washtenaw County area. I'm going to get this acronym.
We call it the Wave Bus for short.
Yeah, the Wave Bus. She's also the founder and principal consultant of Covere LLC. She's chair of the Washtenaw Commission on Aging, and she is chair of the National Association of Social Work Michigan's Aging Working Group. She is going to join us today to talk about Washtenaw's older person millage. So, Marie, thank you for joining us today, and the floor is yours.
Yeah, thank you. Could you throw up the slide deck for us? While they're pulling up the slides that I prepared for us today, when Lisa approached me about talking about this senior millage, particularly she was interested in the housing transportation spin. And so what I hope to do with you all today is just give you a quick background on like what's a millage, how did we get to this is what we need, and then where are things at today. We're not seeing the slides yet. If I share my screen, is it okay if I share my screen?
I'll pull it up real quick.
Okay. Yeah, great. So my information and then my email's there, and I can put my email in the chat when we're done too. But first, I just wanted to level set, like make sure everyone understands what a millage is. So you can go to the next slide, please. A millage is a property tax. 1 mill represents about $1,000 of a property's assessed value. So there's an equation there, but as an example, a 0.5 mil on the taxable value of a $250,000 property, that property tax, that mill that you pay would be about $125 annually. And when I talk about the Washtenaw County senior millage, older persons millage, we have a 0.5 mil. Next slide, please. Up until, 8 out of the 83 counties in Michigan do not have an older person's millage, a senior millage, or however that's named or framed. It was 9, but thankfully Washtenaw has joined the crew. This is really important as a sustainable funding source. And I know you guys are going to be talking about the instability of some of the federal funding sources that we have right now for housing. And aging services is in the same boat. And honestly, we just haven't had a lot of access to funds, period, in the past. Less than 2% of philanthropy supports older adult services. That's senior housing, senior transportation, senior centers, list goes on. Less than 2% of philanthropy goes into this. Article I was reading from Forbes said less than 1%. We've consistently been seeing this decrease. And then the Office of Older Americans, the OAA, has not kept up with inflation or population growth. Can you go to the next slide, please? So here you can see the yellow line is ages 50 plus or 60 plus, that population. We're steadily growing. We all get to live longer, healthier lives. It's a pretty great thing. The OAA funding appropriation has remained pretty flat in comparison to that growth. And then when you adjust for inflation, that's the blue line where we actually see we're investing less in older adult services. Can you go to the next slide, please? I have just a couple of quick charts. I want to show the anticipated growth of the aging population and why a senior millage is helpful, why we need sustainable funding, why we need infrastructure. I got this chart from the Michigan Labor Department. This was their map of counties. They use 65 and older. And Lennox, not now. Thank you. We see this grow significantly by 2050. There's a few areas where it looks like we have a few less of the older old in those counties, but overall, as a state, we are aging. Can you go to the next slide, please? And then specifically for Southeast Michigan, where I am, Washtenaw County is, first image is what townships and municipalities look like in the counties that make up SEMCOG, Southeastern Michigan Council of Governments. And then the second chart is where they predict population to be by, this is so pretty significant growth, right? When usually in the aging sphere, we don't like to associate more older adults with like bad and red colors. This is alarming. This is scary. We've moved away from the silver tsunami kind of talk and the age wave and those types of things. But what SEMCOG was really trying to show in this graphic was that the infrastructure we have in these communities, the access to transportation, access to housing, access to caregiver services is just not where it should be for the rate that we are getting older in our communities. You can go to the next slide, please. So, Washtenaw story. I'll be really brief. This comes from a much longer presentation that I did for NASW Michigan at their spring conference. But the aging sector in Washtenaw County has always been really mindful and collaborative. And that starts way back in 2004, where we, the aging sector, went ahead and made our own blueprint for healthy aging. In 2010, we had a funding model in the county between the county, philanthropy, and other areas where they had coordinated funding. Because of that, they required meetings and collaboration. So now the blueprint that existed was sort of a redundant group. They were meeting about the same things. So that started to fade. But then in 2017, coordinated funding started to fade. So in response, the aging sector, senior centers, transportation, housing, it's a lot of these same groups that I've been mentioning already, but they formed Say Yes to Seniors. They requested an older person's millage starting way back in 2017. Next slide, please. For various reasons, the county commissioners were hesitant to put the millage on the ballot. One of the reasons was that the county is reaching our millage max. And if we're so close to the millage max across the county, were there going to be other strategic ways to millage the entire county and get senior resources and do some of these other projects the county was looking at? So to give themselves a little bit more time, the Board of Commissioners made in 2020 the Commission on Aging, and I've been sitting on that body since its inception. We were able to advocate for 8 million, or we recommended 8 million in county ARPA funds. So if you're not familiar with ARPA, it's the American Rescue Plan Act. That's the dollars that came during and after COVID. The Board of Commissioners were like, we haven't been investing that level of funding into these aging services that you all are talking about. We still don't fully understand everything that's there. So let's start with 4 million and then see where that goes. And it went quickly. Those dollars went quickly. We showed the impact. And so when 2024 came and they were ready to think about putting the millage back on the ballot, we had data, we had numbers, we had proof of concept. And so the Commission on Aging recommended a 0.5 millage for older person services, as well as recommended a separate office on aging. They put it on the November ballot, and the voters said yes. Go to the next slide, please. I'm not going to read through all of these because, again, it came from a much bigger presentation. But the thing that I really want to emphasize how we approached it this last bit, because remember, we started talking about older person's village back in 2017. That took a long time. And some of that progress, a lot of the progress really didn't happen until the last year and a half. And for somebody who was watching it for a long time and then participated in that last final stretch, the things that I noticed that made the biggest difference for our policymakers in the county is to build relationships. So there were some members of this sector who were just so mad that the county commissioners weren't listening, and they would show up at public comment and they would yell, shame. They would just the language that they were using was like, how dare you not fund this? How could you not do this? How can you not see the value in this? And I don't know if you guys have ever had to talk to policymakers, but when you start talking down to them and mean like that, especially in front of a group of other people, that doesn't really help your case. And so what I and some others did is we built individual relationships with the county commissioners. We built relationships with their staff. We wanted to share, this is, my knowledge, this is my experience, this is what my service recipients are saying they need, they want. This is like the case, right? Build that human relationship, because that helped make a very big difference. You can go to the next slide, please. And so just some suggestions: invitations to coffee, touring agencies, ask them questions. Something that we know in social work is that if there's a dialogue, if there's a back and forth, if they feel like they are also giving back and participating, if we can build that rapport, the relationship becomes that much stronger and they'll trust it more, right? So ask them questions, ask about their motivations. What are they really, when they talk about something like a senior millage, what are they really worried about? Are they worried about overhead costs? Are they worried about partnering with agencies versus expanding county government? Like, what's going on, and how can we have a conversation about it and learn more about both sides? Next slide, please. More suggestions. You can go ahead to the next slide. More suggestions. You can go to the next slide. And so the other piece that I felt was really important, instead of the aging sector, historically, these past many years, have been saying, this is what we want, give it to us. Let's build out that case. Let's tell them a little bit more about why we need this, why our cost estimates where they are, why we think these areas are going to be the most impactful for the dollars that we ask our community members to give through taxes, right? How can we show them that not only are we a relationship that they can trust and feedback what they can trust, but how can we show them that we're actually experts, instead of saying, I'm an expert, you need to believe me. what can we do to build that confidence? And so the next few slides are suggestions of that. We drafted reports, one-pagers. We came equipped to conversations with data and stories. And also, if we didn't know something, because aging is a huge field, right? We have senior housing experts, we have senior transit experts, we have all these different pieces of the sector. If I don't know something about housing, I know who to talk to. I can say, I'm sorry, Commissioner so and so, I don't know that number, but I can find out for you, or I can connect you to the person who has that information. And that again helps build trust, competency. This is where I'm an expert. And I mean, shows that there is competence in the field that they are looking to expand into. Next slide, please. This is an example of one of the deliverables that we gave. The Commission on Aging put together an aging needs summary. We looked at the last few needs assessments that were done by the Area Agency on Aging and a local community foundation to just lay it all out and show them these are the demographics. This is what housing looks like, transportation, socialization. This came out shortly after COVID. So technology, digital inclusion were all big pieces of what was in those needs assessments at the time. There was a lot of, I can go into details, but we're short on time, so we can go ahead to the next slide. This is also available on the county website if you would like it. And the formatting looks as it should if you get it from the county website. This is the other deliverable that we gave. So this one was like at the final hour before the Board of Commissioners had to decide whether it was going to go on the ballot or if they were going to continue waiting. And so the Commission on Aging made this 2-pager. It was just a front and back sheet where we showed this is the aging population in Washtenaw County. This is where we have more seniors than youth in our county. This is, 85 plus are the aging population we probably see in services most frequently, or some of their needs have grown more complex, so they need a few different things. And so tracking that number was really important to us. We shared that graphic from SEMCOG, and then we just told them these are some of the possibilities, right? These are some of the areas that we could fund. You could fund an office on aging. You could do this kind of work in housing and do this kind of work in nutrition, transportation, etc. And this was really helpful to get this across the finish line. This showed that we knew what we were talking about, that there was urgency, that it was needed. You can go to the next slide, please. So where are we now? In July, the Board of Commissioners passed their policy document that included their priorities and included the structure for the Office on Aging, that would be its own entity and not a sub office in a bigger previously existing office. They had a director job description in there. And then to date, so property taxes are pulled in December. So it was voted in November. We got, the county received the funds December, January. And our county commissioners have been trying to pay attention to what's happening at the state and federal level, especially as the feds decide to change some funding mechanisms. The state is likely to pivot and decide what they need to do in response to that. And then, so we as a county locally, what do we want to do about that? And so as they've been working on priorities and the structure, and now they're searching for the director of the office, so far they've released about $500,000 for food. It went to right after USAID closed. It really impacted one of our major food hubs. So we set aside money for that. $100,000 for seniors in crisis program. That's part of the larger Barrier Busters utility eviction prevention kind of work. And they're about halfway through those funds now. And then they just recently released an RFP for transportation. This initial one will be about 6 months. It's only for $1 million. The commissioners, again, through conversations with me and other partners who do senior transportation, we explained how the state's local bus operating formula has been decreasing the last few years. In rural areas, the state is allowed to reimburse up to 60% of our eligible expenses. Last year was 40, this year's 34.5. Next year is probably going to be 29. The budget's not done yet, but it's probably going to be 29%. And those cuts are really hard, especially for transportation, and especially for rural transportation. So the county has put some of the senior dollars to an initial infusion, and they hope for all of the programs going forward, the ones I've mentioned, and there's a significant list within their priority document. They hope to continue funding and fleshing out. Do I have another slide on here? That was probably it. Yep, that was probably it. So that was a lot, really fast. Are there any questions, comments?
Thanks, Marie. Does anybody have any questions? If you could raise your hand in the chat or just chime in real quick, we'll go ahead and answer any quick questions. And if you don't have,
Please comment in the chat. This is very inspiring that advocacy works. It does work. It does work. Keep it up. It's not a fun environment these days, but it really makes a difference for the people that we're serving.
Right. No, and I definitely appreciate your comments, Marie. I think that is, as we get later into this conversation and into the slides that I'm presenting next, that is where we need everybody. We need people out communicating with their elected officials. We need people advocating for things that matter in their community. And obviously, Marie, with all of your hard work and those that you partnered with, this is a great opportunity in Washtenaw County for the aging population. So without any further questions, I believe Marie's contact information is right there. We'll send it out in our follow-up email. Just want to thank Marie for being here today, and we'll go on to the next presentation. Thank you, Marie.
Yeah, thank you.
Elizabeth, could you share the slides again? All right, this is the fun portion. There's been nothing going on at the federal government, nothing to worry about. Everybody's in a great mood, and we can end the slide presentation, correct? No. Next slide. I'm going to start with some positive news. We have the Road to Housing Act, which just was passed bipartisanly outside the Senate Banking and Housing Committee. This is a bipartisan bill that went through a markup. It was the first full markup of a bipartisan bill in the Senate Banking and Housing and Urban Affairs Committee in over 40 years, or not 40 years, sorry, over a decade. They have all types of provisions in this, including financial literacy, housing supply, manufactured housing, home ownership, program reform, veterans housing, oversight, coordination of housing programs and agencies, touches on disaster. It does not touch on certain areas such as disaster relief. The things are that we need to continue to talk about. But this is a positive step forward that the Senate has recognized that there's a lot of problems with the housing stock in the United States. This is positive news in comparison to everything that's been going on at the federal level. But there are problems with this bill. A lot of this focuses on the middle income, middle housing. There's a lot of issues that increase housing stock, but then also roll back protections for tenants. So there are some tweaks that need to be done with this bill. There are amendments. I know some of our elected officials in the House have reached out saying we see this bill moving forward. We know it's bipartisan. What are your comments? Again, going back to Marie's point earlier in this conversation, you have to advocate. You have to get in front of your elected officials. You have to continue this conversation. If you see in the chat, we posted both the Senate remarks on the bill, but then also the National Low Income Housing Coalition's comments on the bills. So I encourage everybody to take out and look at the Renewing Opportunities in the American Dream to Housing Act that was passed out of committee unanimously and onto the Senate floor. Take a look at this bill and start planning to advocate to your elected officials on how this will impact your community and your programs. Next slide, please.
And Nick, before you go on, Max asked, are Peters and Slotkin co-sponsors on that legislation?
Max, I'd have to get back with you on that one. I'll take a quick look at that and let you know. The executive order. This is where things are starting to unwind. This is where we are starting to have a lot of angst in the system. The executive order came out on not this past week, a week and a half ago. It really focused on sending us backwards. It removed housing first policies. It criminalized being homeless. It removed certain protections for those that are living on the streets. It just sends the wrong message. If you read the executive order, which we just posted in the chat, you'll understand it makes homelessness sound like it's a crime epidemic. This is not the tone we need to set. The tone we need to set is we need housing resources. We need mental health resources. We need substance use disorder resources. We don't need to criminalize homelessness. What this is going to become, as all of you know, there aren't enough psychiatric beds in the state of Michigan. This is a well-known fact. This executive order is having the Department of Justice and SAMHSA under the Department of Health and Human Services actually look at force institutionalizing people. We all know that if there aren't psychiatric beds, what becomes the next best place to go? Or at least what people say is the next best place to go. They send them to jail. That does not help the mental health of anybody. That puts our homeless people in danger. It puts our jails and our sheriffs in danger. We need resources. We need housing first. We need mental health resources. We don't need to continue this situation of saying being homeless is a crime. We need to fully fund our housing and also our mental health resources. So take a look at this. Take a look at the bill. The one thing is an executive order directs agencies to do something. Take a look. If you read the executive order, it talks about the Department of Health and Human Services. It talks about the Department of Justice. It talks about SAMHSA. It talks about some of these other resources out there that touch homelessness. HUD. It doesn't necessarily tell that tomorrow we're removing harm reduction. It doesn't say that we're going to start putting people in force institutionalizing tomorrow. This is telling them to look at these programs and how to seek these proposals. So what I want you to do and what I encourage you all to do is talk to your elected officials, talk to your members of Congress, continue this conversation. Just as Marie said earlier, it's not that we demand this. Show them, explain to them, talk about the impacts, build a diverse coalition, talk to your sheriffs, talk to your prosecutors, talk to your mayors, talk to your city councils. Those are the people that are going to help make this executive order show that it's not going to be impactful, that it's actually going to exacerbate the situation. So I encourage you all to do that. Next slide, please. Well, it continues to go from here. Where do we start? The reconciliation, the One Big Beautiful Bill Act was signed into law on July 4th. It drastically changed our social safety networks. It was supposed to save and not add to the debt. But the nonpartisan Congressional Budget Office estimated an increase in $3.9 trillion over the next 10 years for the federal deficit. What does this mean? How do we get there? Well, we have Medicaid. Medicaid redetermination is going to get more difficult. By 2027, you're going to be redetermining every 6 months. How does that impact our homeless communities or precariously housed? Those notices are going to go out. They're going to lose their coverage. It also includes work requirements. These work requirements were added to able-bodied adults. What does that mean? That is up for debate. Who is an able-bodied adult? Where do we? These are all concerns that we have that we must continue to talk about, especially when you're dealing with the homeless communities. How do we continue to stay in contact with people? This is negatively going to impact roughly 700,000 Michiganders. And what this does is it puts people that have had health care since the Healthy Michigan Plan was put in place. This puts their healthcare in jeopardy, and it's just going to cause stress on our hospital systems, on our FQHCs. You're going to see rural hospitals shut down, and the impacts are going to be long term. A person that's on the Healthy Michigan Plan forgets to redetermine. They go to the emergency room. They have a hospital bill. They have more mouth than month. They can barely make ends meet. They get a bill from the doctor's office. They are now in debt, medical debt. They lose their house. It's just a snowball effect. So it's going to impact housing and homelessness. Next slide, please. SNAP. SNAP starting in January 2027. We're going to see parents with children over the age of 14 have work requirements. Adults 54 to 64, which right now, if you're over the age of 54, you don't have a work requirement for SNAP. And then they also changed the Heat and Eat program. LIHEAP is what we mostly know it as. So all these changes are going to impact what they have at the end of the month to bring home, to pay for heating, pay for their rent. These are going to impact people on a daily basis. This also shifts the burden, so the state of Michigan cannot pick up the tab. The Citizens Research Council the other day released a report that these changes under the One Big Beautiful Bill Act is going to add $1.1 billion. Take that right out of the Michigan General Fund to make ends meet, to continue these services. The administrative shift goes from 50-50 right now for the state of Michigan to 75-25. So the state match is going to increase. And then error rates, which if anybody knows what an error rate is, which is I could have paid the recipient too much. I could have not given them enough. It could have been just a clerical error. Could have been one of their children aged out. All these errors are calculated each month. Michigan right now is around 9.8%. And that would increase the state share, which normally is 100% federal for SNAP, to 90% for federal, 10% Michigan. So again, this is going to make things a lot tougher on the citizens of Michigan. Again, the impacts need to be told to the members of Congress. Let them see this firsthand. Let them understand what your SNAP recipients go through on a monthly basis, how they struggle to make ends meet. Share those stories. Talk to them. Show them. And this is all great news. That you can continue to share these stories. This will make an impact. The one great thing that came out of the One Big Beautiful Bill, which is to be determined, is LIHTC. They allowed the capital increase in the investment from the investors. They reduced the amount of capital that is due. So this, according to the administration, which we know they like to exaggerate quite often, will contribute about 1 million new homes and existing homes into the LIHTC program. We'll see how that plays out over the next few years, but that was the one good thing that came out of the one big beautiful bill. How does that all translate? Well, this is your mandatory spending reconciliation. That's your taxes, your entitlement programs. What we have now is our yearly budget process with the yearly appropriations. Next slide, please. Go back one slide. So we had 3 proposals total from the president, the House, and the Senate. If you look at the president's proposal, it was a decrease in 51% in funding from FY25. The House was a decrease in 4.7, and the Senate was a slight bump up $3.3 billion. What this has allowed us to do, next slide, please. Explain how the budget's broken down by HUD programs. As you see on the left is the major program areas, tenant-based rental assistance, down to Section 811. The president's budget proposal would have taken most of those programs and consolidated them into one grant. That was about $31 billion, which wasn't even enough to cover tenant-based rental assistance. Additionally, on the homeless assistance grant, he combined HOPWA with the homeless assistance grants and actually decreased that. This would have been horrible for the homeless response system and the homeless safety network. This would have gotten rid of COCs. This would have consolidated programs. It would have made you pick winners and choosers. Luckily, the House and the Senate both took those proposals and rejected them overwhelmingly. The House was a little bit more conservative, as you see the breakdown there. The tenant-based rental assistance was a slight increase. It may have been able to cover all the vouchers out there, but it would not have covered the emergency housing vouchers that are out there since COVID. And we don't even know if that $32 billion would have covered all the existing housing vouchers right now. Kind of breaking down each program area, you would have seen a slight increase in the CDBG grants. Everything else pretty much remained flat, except for the Fair Housing Initiatives programs. That was reduced to $29 million. Additionally, under the House proposal, HUD staff was reduced by 26%. What this would do is this would have reduced all staff. You would have seen problems in your grants. You would have seen problems in program administration. The trickle-down effect of that would have impacted you at the local area. Now, we flip over to the Senate proposal, which passed out of the Senate committee 2 weeks ago on the same day the executive order was passed out, 27-1. That was a very bipartisan bill. We actually saw an increase in tenant-based rental assistance. Again, that would have covered all the vouchers that are out there right now, but maybe not covered any more expansion on those. The other thing is, again, it did not include those emergency housing vouchers. We have problems that they aren't covered. We don't know how this is going to affect people right now. The program for those emergency housing vouchers was originally forecasted to go to 2035, then 2030, and now because of the increase in rents, they see those rental assistance running out in 2026. So that's about 59,000 people nationwide that are affected by those emergency housing vouchers. The question is how's that going to play out over the next year? How do we take care of those individuals? There's just under 1,000 people in Michigan that are impacted by those emergency housing vouchers that came out of COVID-19. Next slide. The breakdown, the three proposals, President's proposals was major cuts and program consolidations. We already talked about that. Shifts the focus away from targeted homelessness to just a blanket response. We don't talk about programs that work best. It allowed it put a 2-year time limit on assistance, directed HUD to give only those 2 years of assistance, then move somebody on. We know that doesn't work. We know it takes a lot longer than 2 years to have stable housing. Then the House proposal rejected a lot of those consolidations, a lot of those proposals that the president had, kind of focused on fiscal restraint, kind of going along the lines of what the One Big Beautiful Bill proposed. It did maintain a lot of the core programs of HUD, but it did reduce that overall HUD footprint. Kind of going towards the talking points of slim down government, fraud, waste, and abuse. That's kind of the talking points that came out of there. The Senate proposal, though, increased a lot of funding for key housing programs. Again, not everything we wanted, not everything we need, but there was increases. Rejected a lot of the harmful restructuring of HUD. And then the one thing that was not in the president's proposal and wasn't in the House proposal was the Home Investment Partnership Program. The Senate did include that. That's $1.25 billion going forward. So we'll continue to see that investment in the Senate proposal. Next slide, please. It's not too late. This is the beginning of the conversation, not the end of the conversation. You can take action. Take action. We need your support. We need you talking to your members of Congress. I had great conversations with staff from members of Congress's office on both sides of the aisle. They want to do what's best for their community, but they need to hear from you. Next slide, please. A lot of you have seen these slides before. Sign on to a national letter. National Low Income Housing, the National Association to End Homelessness, all these groups, the Nonprofit Association of the the coalition, all of them have letters to sign on. Continue to sign on to those letters. Urge support from your members of Congress. Next slide, please. Talk about what is needed. Go to the Mcah website. We just updated it. We're keeping a tracker. We're sending out action plans. Get out there, set up meetings with your members of Congress. If it's not the member of Congress, talk to your district director. If it's not the district director, talk to somebody in policy in DC. Let them know how this is going to impact your community and how that affects not just the unhoused, but everybody in the community. We also talk about talking to your national partners, including the National Low Income Housing Coalition. Here are their priorities. These are things that will continue programs into the future. It will expand programs. And again, these 59,000 households that rely on these emergency housing vouchers are critical to make sure that they don't fall through the cracks. Next slide, please. Use the toolkit, the Reject Housing Cuts and the Emergency Housing Voucher Funding Cliff action toolkit put out by the National Low Income Housing Coalition has some things that you can do out there. Post on Facebook, post on Twitter, post on Instagram, all these different platforms, Blue Sky, wherever you can get the message out, talk to people, share your stories. Amy just sent out a notification in the chat. Reach out to Amy, share your stories, share your organization stories, share those that the persons with lived experience, have them share their story. Next slide, please. And here are some additional resources. There's the Attorney General has her tracker, the National Council on Nonprofits, has administrative orders and EOs at how they've been hit us. And then the National Housing Resource Council, National Housing Council has their Housing Resource Center. Great tools. They have best practices. They have policy papers. They have issues going on in other states. Take a look at it. You'll find it very informative. MISHDA has a paper up there right now talking about what they've been doing in the state of Michigan. All right. And then always tell us about your action with your member of Congress. Reach out to us. Tell us what's going on. Tell us what successes you had, what failures you had, how receptive they were. Feel free to share that. I know I'm going quick today, but there's just been so much going on. I wanted to make sure we get through this. And at the end, if we have a few minutes, we'll talk about if anybody's met with their member of Congress, what has been going on, and if they've had any positive interaction. Next slide, please. Next slide. State updates. What's happening in Lansing? Rep Wooden and Rep Bierman introduced a bipartisan package that kind of goes along with Senate Bill 278 by Sue Schenck that deals with the housing trust fund stored in MISHDA. It creates the middle income threshold. However, there are concerns with this that it actually impacts those in the extremely low and the low income housing world. We're continuing to monitor this. Just keep watching this, see how it plays out. But this is a bipartisan package. One of the few times in Lansing right now that is bipartisan. And then just last week, former Speaker of the House, Representative Joe Tate, reinstated the tax credit for cash and food donations to homeless shelters, food kitchens, and food banks, up to $150 for a single or $300 joint. I know a lot of you, this could be impactful. $150 or $300, $400 is immense on how much buying power you all have when you consolidate that. So hopefully this will be a tool, just another tool in the toolkit to get people to invest in their community and their homeless shelters, food kitchens, and food banks. Next slide. My favorite area. For those of you that don't know me, I'm Nick Cook. I was formerly in State Senator Sylvia Santana's office working on the DHHS budget as her chief of staff, and love the budget. Absolutely love talking budget. And I will talk all day about it. The Senate passed their bill in mid-May. But the House has not completed or passed budgets out of the Appropriations Committee yet. We took that July 1st deadline and went flying past it. And as I talked to some of the House and Senate staff, I was told negotiations to begin talking about negotiations are being had. So they are no closer to passing a budget than they were 2-3 weeks ago. What does this mean? Everything's kind of in flux. We could go to, if we get past September 30th, we go into October, it could be a government shutdown. We could have, a last minute appropriations deal. But really the big sticking points right now is the impacts of the One Big Beautiful Bill Act on the state of Michigan. The Citizens Research Council, I said it was about $1.1 billion, the impact to the state of Michigan. You have the roads plan that the House has introduced and the governor is pushing. Speaker Hall has also talked about a tax cut. So there's a lot of plans out there, a lot of moving pieces. This impacts everything. One thing, the school aid budget not being passed, free and reduced lunches are going to be impacted. You see these impacts everywhere. So what are we doing? Again, talk. There's still time to weigh in. This is as I used to always tell people, this is the beginning of the conversation, not the end. you can actually start talking to your member of the legislature, state legislature, and have impact on those conference reports. Both the House and the Senate have to come together, negotiate, and pass what they call a conference report when the two bills don't match. And then in the House report, anything can be added right now. They may put rules in place that change that, but right now, anything can be added to that conference report. So if it's important to your community, important to your organization, talk to your members of the state legislature, continue to advocate for those people around you. Next slide, please. Advocacy is crucial. Raise your voice. We've already kind of talked about this. Don't be afraid to go in when there's a bill up in committee, put in a card of support or opposition, provide testimony, share your story. Your stories are impactful. The person with lived experience in your organization, their stories are impactful. These cuts that are coming from the federal government are going to impact all of us, and it could be detrimental to our communities, set back people's lives for decades. So we need to continue to share those stories, talk about the impacts, and continue to talk. Next slide, please. I'm going to go into the Michigan Coalition Against Homelessness updates. We now have new staff and a new intern. Last month, you welcomed 2 new interns. We now have Sarah Prout-Rennie, who's our Senior Director of Advocacy and Engagement. A lot of you know her from the board at Micah. Some of you know her from when she was the Executive Director for the Michigan Coalition to End Sexual and Domestic Violence. We've taken her talents, added her to our team, and she's now our Senior Director of Advocacy and Engagement. So your organization may be hearing from her shortly to talk about how we can better support you all. And then Natalie Bakken, who is from University of Southern California. She is a Michigan native. She's here for the summer. She has loaned her talents to us, and we really thank her for being on board. Next slide, please. All right. I'm going to be quiet here for a minute, and I'm going to turn this over to Elizabeth.
Sorry, I had to unmute myself. In August 28th, for those of you that were with us at our June meeting, we had Dr. Selena Gomez from Vote Writers. And Vote Writers really works with the whole nation, and they work to inform and help citizens to secure your voter ID, talk about misinformation that keeps people from going to the polls and voting, but it helps inspire and support organizations, works with local volunteers and communities to sustain that voter ID education and assistance efforts. She's really wonderful. It's a free webinar, about an hour, from 12 to 1. If you can come show up, we'll send out a link to register, but she's really great. Yeah, definitely come see her with us. And then in August 18th, we have another training. It's best practices for serving survivors of human trafficking. This training, there will be CEUs available, but it is free otherwise. You can contact Allison for email for that. But in this interactive training, participants will get to gain a really comprehensive knowledge about human trafficking and talking about just, legal definitions, different examples of sex and labor trafficking, because those are things that sometimes we don't necessarily see as either of those things, and discuss how trafficking can co-occur with other forms of trauma and violence. Participants will also explore the unique housing needs and the barriers faced by survivors. And we all know that everything will be affected differently in ways soon. So this is very relevant. We'll learn strategies to promote safety, stability, and empowerment.
Thank you, Elizabeth. Just to remind everybody, we have our September LAC meeting, but we have a new date. I don't think anybody really wanted to come in on Labor Day. which was September 1st. So we pushed it back 1 week to September 8th. With that, you'll have to go out and sign back up for our webinar or through Zoom. We have dropped the link inside our chat, and we will also be sending it out beforehand to remind everybody we have to sign up for their new link. But just wanted to share that with everybody. New date, September 8th for the September LAC. Next slide, please. Where you come in. Anybody have anything that they would like to share before we start concluding? We got 5 minutes. Any questions or yes, Max, go ahead.
Hello. I'm curious if at the state level, if there's been any conversations, because I know we've seen federally that the COC programs seem to be spared for right now, but I'm curious if at the state level there's been any conversations around contingencies with MDHHS or MISHDA around what would happen if that became block grants to the state and how maybe they have a plan in their back pocket on what that administering that might look like.
Max, I know this in conversations with MISHDA, this was one of their biggest concerns. They didn't want to set themselves back, 30 years when we went to the homeless assistant grant. So there were talks about changing that. What would it do? Where does the backfill come? As you see, over the years, we've talked about cuts to SNAP, we've talked about cuts to Medicaid, we've talked about cuts to this, that, the other thing. But this is a full onslaught. The question was really, how do we slow it down? The good news is it does appear that Congress understands that homeless assistance grants are necessary as part of the response system for the community, but it is always a threat. Right now, I think everybody's kind of taking a deep breath and letting, see how Congress continues to respond over the summer. But this is important to talk to your elected officials. Talk about what the COCs do for the community. Talk about your coordinated point of entry. Show them what this means. Don't just talk about it. Take them out there. In some members of Congress, it's easier to show them. Other members of Congress, it's difficult, but it's the community support that gets there. But right now, Max, I think everybody's kind of moving on to how do we preserve Medicaid and SNAP and some of the other programs that were cut versus COCs. The focus is shift, but it's still on everybody's mind. I hope that answered your question, Max. All right.
Nick, there was a question prior in the meeting about the executive order ending crime and disorder on America's streets. Cecilia had asked, agencies like law enforcement are not required to enforce it. Is this just a recommendation by the White House and not an actual law? Can you clarify the nature of the executive order?
Correct. So, Cecilia, it's a little bit more nuanced than that. So, executive orders direct it directs the executive branch to do something. When you think about the three branches of government, Congress has the power to enact laws, executive branch has to enforce them. So this is telling DOJ to look at doing something. How can they use current laws to, force institutionalize people? How can they put them in jails if they're a threat to the community? And then how do they also work with the local partners? So you're going to start seeing over the next few months more come out on this from federal DHHS, the Department of Justice, on how they plan to roll this executive order out. This executive order did not have a time specified in it, unlike some that we saw 30, 45 days. So this is not a law. This is just directing departments to do things. So I hope that answered your question, Cecilia. All right. We have 30 seconds here. This is my contact information. Please reach out. Please feel free to call me, email me. love to have conversations with all of you. Can't wait to meet all of you. This is, like I said, this is a passion. It's a calling to do the work that you all do, and I appreciate it every day. If I can be of any assistance on giving you insight into the legislature or what's going on at Congress, please feel free to reach out. Again, please reach out. Please sign up for the September LAC, and then we'll get back into the October LAC. We'll be at the normal time, and November and December. But I really appreciate everybody being here today. And with that, thank you for your time, and I'll see you next month.